History of health services in India. And I will submit this to Dr. Bakir Beg to answer.
Next.
Okay, who is making noise? I will give class. Okay? So you are interfering to others.
So the first basic question is, what is the health system? Health systems and policies have a critical role in determining the manner in which health services are delivered, utilized, and affect health outcomes. Health being a state subject despite the issuance of the guidelines by the central government, the final prerogative on implementation of the initiatives on newborn care lies with the states. Now, the other topic is the public health care system in India evolved. Actually, this is the history of public health service in India. So, the public health care system in India evolved due to a number of influences from the past 6 years, including British influence from the colonial period. Actually, we are occupied by the British after the War of Independence in 1857. So, British have much influence on peoples of Hindustan. The need for an efficient and effective public health system in India is large. Public health system across nations is a conglomeration of all organized activities that prevent disease, prolong life, and promote health and efficiency of its people. Next. So here is the graph, as you can see, the historical dominance of Indian health services.
So it is your Sioux?
Yes.
Yes, sir.
Yes?
Yes, sir, it's my CEO.
Okay, so was to present it today topic and after your name?
Sir, I'm also.
What?
So now the historical dominance of Indian health services. As you can see the graph, this is the graph for black and non-Hispanic people, American Indian or Alaskan natives, and all others like Hispanic, white, non-Hispanic, Asian people. This is the graph. And Indian healthcare system has been historically dominated by provisioning of medical care and neglected public health. About 11 to 9% of all maternal deaths and 18% of all infant mortality in the world occurs in India, ranking it the highest in the world. Next. So, death rate causes in India. 36 out of 1,000 children are dead by the time they reach the age of 5. 62% of the children are immunized. Communicable disease is the cause of death for 53% of all deaths in India. So here is the organization of health system in India. Actually, the ministry is controlling all the health department like health ministry and family welfare. India have Department of Health and Family Welfare, Department of Health Research, Directorate General Health Services, Technical Advice, Implementation of Health Programs, Central Drug Standard Control Organization, National Health Authority, Food Safety and Standards Authority of India. The healthcare system is organized into primary, secondary and tertiary levels. So, primary level have sub-centers and primary health centers. And secondary level have community health centers. And later on, tertiary level constitute hospitals and medical colleges.
Okay, stop here. So
We have Tehsil headquarters in primary level. Tehsil headquarters, hospitals.
Yeah. So they are named no sub-centers, not primary health centers, but little different. Yes? Okay, next.
At the primary level are sub-centers and primary health centers. Sub-centers. A sub-center is designed to serve extremely rural areas with the expenses fully covered by the national government. Mandates require health staff to be at least 2 workers, male and female, to serve a population of 5,000 people. or 3,000 in a remote, dangerous location. Sub-centers are also work to educate rural people about healthy habits for a more long-term impact. Actually, our Tehsil headquarters are included in, if I am talking about Pakistan, are included in sub-centers in a primary level. Here is a sketch, as you can see, sub-center in which health and welfare center and 24-hour service, telemedicine, medicine vending machines, NCD screening, medical health, diagnostics. Primary health centers exist in more developed rural areas of 30,000 or more, 20,000 in remote areas, and serve as larger health clinics staffed with doctors and paramedics. Patients can be referred from local sub-centers to PHCs for more complex cases. Here is one of the primary health center in India. I don't know the city where it is located. At the secondary level, there are community health centers and smaller sub-district hospitals. Actually, the district headquarters hospitals are included in secondary level. Here is one of the community health center in Balasore city of India. District hospitals are the final referral centers for the primary and secondary levels of the public health system. It is expected that at least one hospital is in each district of India. Although in 2010, it was recorded that only 605 hospitals exist when there are 640 districts. Here is one of the district hospital in Sonapur, the city of India. The top level of public care provided by the government is the tertiary level, which consists of medical colleges and district and general hospitals. All India Institutes of Medical Sciences is owned and controlled by the central government, like we have federal government in Pakistan. These are referral hospitals with specialized facilities. A regional cancer center is a cancer care hospital and research institute controlled jointly by the central and the respective state governments. Government medical colleges are owned and controlled by the respective state governments and also function as referral hospitals. Here is a picture of All India Institute of Medical Sciences. Now, the private health. India ranks among the top 20 of the world's countries in its private spending at 4.2% of the GDP. Employers pay for 9% of spending on private care health insurance, 5 to 10%, and 82% is from personal funds. So here is a sketch of Indian healthcare system. Indian healthcare system consists of public health, private health sector, and indigenous system of medicine. Public health consists of primary health center, or like secondary level or tertiary level, like hospitals and health centers. And private health sector consists of private hospitals, polyclinics, nursing homes, general practitioner and clinics. Now what is the indigenous system of medicine? Actually, the traditional method of medicine is we can say that it is the indigenous system of medicine, like Ayurveda, Yoga, Siddha, Unani and Tibbi, and homeopathy. You can guess from the name of the homeopathy as well. Next. History of Indian healthcare system. Public health systems in the colonial period were focused on healthcare for British citizens who were living in India. The period saw research institutes, public health legislation, and sanitation departments. Although only 3% of India households had toilets at this time.
So sad.
Yes, you can see a British time hospital in India. Next.
MashaAllah.
It is one of the, like you can say, the ancient pictures of ancient time. And that's all, sir. Thank you.
Clapping.
Now question.
Any question after this?
So it was topic history of Indian healthcare system.
Yes. Do you have any question? You can ask me.
Okay. What question you have?